Hi, all. My name is Arin Gautreaux. I'm a third-year MSW student and participant in the Child Welfare Training and Advancement Program at the University of Washington, Tacoma. My capstone is Raising the Community Tide, Fighting Poverty's Role in Child Abuse and Neglect Through Community Development. My practicum experiences have been with the Department of Children, Youth, and Family Services, or DCYF, where I've had the opportunity to observe front-end services such as CPS investigations, back-end such as child and family welfare services, and family recovery court, which the latter assists families that are struggling with substance use disorders as part of their child welfare cases. And I've had the opportunity to observe some administrative operations as well, such as quality assurance and continuous quality improvement. In both my practicum and academic pursuits, a consistent theme that I've seen across research and experience is that frequently families who are impacted by the child welfare system lack resources. Poverty is considered one of the most reliable predictors of child abuse and neglect in the home, putting low-income families at risk of perpetuating cycles of abuse. A rising tide lifts all boats is an aphorism for an economic idea that suggests that a healthy economy leads to a healthy community. Raising the Community Tide is a program designed to provide communities across the state with funding and assistance to create culturally relevant community building programs that provide childcare, economic growth, and prevention educations to family in need. It's designed to do so by actually administering grants rather than being a program that applies for grants. According to the U.S. Department of Health and Human Services, during the 2019, the child welfare system removed over 250,000 children from their families due to child abuse and neglect. Almost 424,000 children were in the foster care system as of September 30th, 2019. Survivors of child abuse and neglect will have, on average, shorter lifespans, worse physical health, more mental health challenges, and a higher likelihood of perpetuating violence later on in life. There's no question about the damage that child abuse and neglect does, and that we as a culture must put an end to child abuse and neglect for the safety of both our children, present children, and our future society. However, one of the paradoxes that child welfare faces is the impact of foster care on the children that we remove from their homes. Across multiple studies of children who've experienced the foster care system, between 35% and 60% of children in the foster care system experience post-traumatic stress symptoms at a clinical level that impacts their daily lives, and that rose after going into the foster care system. So one of the goals of raising community tides is to prevent child abuse and neglect before it occurs. While DCYF provides case management services once a family enters the system, there are not currently prevention services before DCYF receives an intake on the family. Additionally, once a family's case is closed in the system, the state no longer provides services such as childcare in connection to therapeutic supports. This can cause families to re-enter the system after their initial case is closed because they no longer have access to services that were allowing them to have a more stable and safe home. So one method to address both of these issues and lessen the number of system-impacted children is a program that targets both community poverty and misinformation regarding child rearing. Poverty, again, is one of the most reliable predictors of child abuse and neglect in the home. It follows that by providing economic resources, childcare, and education to parents, we can lower the risk of child abuse and neglect by lowering the economic disparity of a community. However, Washington state low-income communities' needs differ drastically across the state. By providing resources to those low-income communities to be administered per county by local community leaders, it allows responses to better meet needs specific to individual communities. Raising the Community Tide is designed to be a 5-year project. and it is designed to encourage economic growth in low-income communities across Washington state. By utilizing funds from the 2021 Washington Capital Gains Tax, this program would create grants to be administered by DCYF. The process would begin with the department hiring 2 program managers per region, and the CYF splits the state into 6 regions, some of which have many counties, some of which are only one county, like King or Pierce are individual regions. The 2 program managers per region, so 12 program managers total, would be hired for the purposes of organizing, administering, and monitoring the project. Program managers would then hire and work with community consultants to help them build policies, procedures, guidelines, and restrictions regarding the grant. One of the factors that I want to remain true and relevant throughout the entire process is including voices that may not get the attention or respect in the child abuse and neglect conversations. So I want in the design of this program, I'm calling for DCYF to pull in the voices of mutual aid groups, unhoused families, system impacted parents, former foster care youth, because those people are the ones that know what kind of real support families on the ground need. At the end of the first year, the department would post requests for proposals, which would then be considered over the first quarter of year 2. Working with local community leaders as consultants during year 1 also helps to put the word out about the availability of these grants once the request for proposals opens, and it helps those community leaders to then share, like, this is kind of what was written into the requirements for the grant. So once the grant recipients are selected, they would be given 6 to 9 months, so basically the rest of that second year, to build and open their programs. The grants would then be funded by the these grants would then be awarded by county and to fund the new programs in the county for 3 years. So basically they would receive funding from their opening in year 2 until the end of year 5. Each county would have 1 grant available, calculated via a combination of the county's population and the relative percentage of individuals living in poverty in the county. So there are 2 elements that these grants must include: the child abuse and neglect prevention education aspect, and childcare, including in the evenings for parents utilizing program services. They would be written to be adaptable because of the differing needs of counties across the state. So for example, one county may choose a program or a recipient whose program includes automotive maintenance for system impacted families as one of the services offered. Another county may include stipends to families who are struggling to pay their utility bills. In outlining my proposal, I figured that I would dream big and suggest a budget of slightly over $1 billion. This sounds generous until you begin to break it down by county. So for the purposes of this proposal, I estimate that split evenly across the 39 counties, each county would get $25.6 million. That is not how they would be broken down, obviously. But that money would then be expected to cover the costs of starting the program, paying salaries of those hired by the program, and any additional financial distributions by these new grant-funded programs. The simple split would not be an equitable division of resources, so I leave it entirely to the hypothetical program managers and their consultants to determine exact formulas for how those funds would be distributed to the counties, like how much each county would get to give as their grant. The success of raising the community ties could change entire communities for the better. It can provide services, employment, education, and even childcare. Success measures would be observed in a reduction of child abuse and neglect intakes and investigations within a given community over a period of at least 3 years. They may also be measured in terms of the outputs of those grant-funded programs. So the number of system-impacted individuals employed by the grant-funded programs, which I would hope would be really something that is strongly encouraged as a part of these grants. They would result in ideally lowered recidivism rates in system impacted families who have frequent intakes. You could measure success in the number of hours of childcare provided by the programs and the number of parents, guardians, and other family members engaging in the education and prevention services. This project is also ideal for collaborations with other state departments, such as the Department of Housing or Department of Social and Health Services, both in kind of getting ideas to the table, but also seeing how the effects of these community programs impact services that they are providing as well. Long-term effects of raising the community tides could be seen in increased family cohesion and hopefully, this is the big idea, increased community building and healthier communities with less income inequality. Those success measures are, of course, a lot harder to measure and may not be seen right away. Yeah, this project has meant a lot to me to kind of work on and develop, and I do want to thank you for giving me the time to go through different aspects of this project. So thank you and good night.